live watching me mic up. This one's yours? That's
Yep.
just sad, isn't it? It's a little bit sad. Oh,
And no one's watching. You know.
that's not gonna work, is it?
Well, it might be
Here,
better.
go ahead.
Might actually be better on this side. So
Yeah. Well,
it
let's
doesn't
just
rub
put
up
them. I'll
against
fall
anything.
over, but that's okay.
That's why you're sitting.
That's right. I couldn't stand up without. I could just stand sideways. There we go. Look at that. It's like a decoration. And I feel really short.
Live. Live streaming and Facebook.
Yeah, okay, cool. Somebody go. With a question. I'm ready.
Who wants to go first?
So can you just start by saying and spelling your first and last name and
sure.
giving your title?
Of course. MARTHABUCHANAN-MD. I'm the director of the Knox County Health Department.
So it's Monday. Can you talk to us about what's new today in your investigation into these upwards of 10 E. coli cases?
Sure. Well, a little bit of good news. We didn't have any new cases over the weekend, so that was encouraging. We continue to pursue our investigation. We sent a note or letter to the daycare facility allowing them to reopen the baby house on Friday. Ultimately, when they're going to reopen is up to the Department of Human Services as their regulatory authority.
There's two different, I guess, places where these cases have stemmed from.
Sure.
Can you talk about just reminding us what those two places are, as well as, if you can, talk about the number affected by each and that breakdown
Sure.
of 10?
Sure. So it's a little more than 10, and most of them are children who report having consumed raw milk in a time period before they became ill. So we've got a group of children, all of whom, or the common thing we can find among them is that they consumed raw milk from French Broad Dairy. And another group of children that the common thing among them is that they attend a daycare called Kids Inc. And at that daycare, they have some farm animals, they have goats specifically. And so we're a little concerned about direct or indirect exposure to, amounts of fecal matter that you couldn't even see on your hands or something like that. So all of those kids are in one classroom or one section of that particular daycare or child care facility. So right now we don't see a connection between the two. They are occurring at the same time in our community. So we continue to look for any possible connection and continue to do our job of investigating to determine really what made these kids sick.
How rare is it that there would be two unrelated incidences happening at the same time in our community?
We have a couple of unrelated cases of E. coli regularly. A couple of little outbreaks of E. coli or clusters of E. coli at the same time would be very uncommon. So that's the uncommon part. It's not uncommon for us to have 3 or 4 people, all of whom have E. coli at the same time, and can find no connection between them at all when we do our investigation. So they're just isolated cases, but these are not isolated cases. These are clusters of kids, all of whom have the same illness.
So what makes this so rare is just the fact that there's clusters and it's not just 1 or 2 different people
Right.
with 1 or 2.
Yeah,
Okay.
absolutely.
And in the scope of, and you've talked about this before in the last few days, in the scope of kind of a normal month, let's call it, is this more or less, or these more or less cases than you normally see?
So we went back and looked historically. We average about 19 cases of E. coli over the years. So that's the average. Some years it's more, some years it's less. And so this is several cases all at the same time. So it is a little more than, but we might not get any more for the rest of the year. We have no way of knowing that.
Did you say 19 cases annually?
We average 19 cases annually.
Okay, just wanted to be clear on that. And you said that the daycare and the raw milk from the farm are unrelated, but is there any overlap? Like, have you seen a kid who attends a daycare who also drank raw milk from the farm?
We've looked at that and we haven't seen it, so we continue to look for that possible connection, that possible link. So what we see is that the kids in the group that were exposed to raw milk do not attend this daycare, and the kids that attend this daycare do not consume raw milk. So we've really looked at that. We've looked for all kinds of different possible connections.
So those 2 cases is when you're talking about isolated. They're isolated from each other, but among the clusters is where they're linked.
So I think I understand. So we have a bunch of children who all have E. coli, and the one thing when we take their history and ask them all the different exposures to that might give you E. coli. The only common exposure they had was raw milk from a particular dairy. And with this other group of children, when we ask about the whole list of possible exposures, the only common exposure they had was the same daycare where they also happened to have some goats.
So as far as what's next, can you talk a little bit about the incubation period? You said there have been no new cases this weekend. What does that mean moving forward?
Sure. So what we know is the daycare closed last Tuesday, or the section of the daycare that we closed last Tuesday. So the last exposure in most of those kids would have been last Tuesday. So incubation period is about 2 to 10 days. So we're not out 10 days from last Tuesday yet. We could see secondary cases in those families, and that means, child A is sick, child B gets sick because they live in the same household and share the same stuff and germs. And then we know that we asked the dairy, and they did stop distributing last Tuesday. We also know that they stopped. We know they stopped production. We asked people to throw the milk away. We can't be for certain that everybody did. So that exposure we hoped stopped last Tuesday, but we don't know. But again, incubation period's 2 to 10 days, so we could possibly see more cases.
And what happens after that 10 days if there are no new cases?
We'll continue to finish up our investigation. I don't think we'll have all the lab results back. We've sent tons of samples. We've sent samples on all the kids. We've sent samples from both locations to see if we can connect the environment with the illness that the children have. So we'll be waiting for those lab results and continue our investigation.
You said a little more than 10 kids overall. I think the hospital said 11 that they had treated in the past 2 weeks or something like that. And then you said a majority of the kids are from the raw milk, and then there's a smaller group. Do you have exact numbers on that, like 8 and 3 or 7 and 4?
It changes all the time, and like some of the kids don't go to the hospital. They get diagnosed as an outpatient by their doctor, so Children's wouldn't have seen them. So, when we look at the whole picture, it is a fluid situation, and it does change. And I could give you a number now, and by the time you air this, it would be wrong. So really try to avoid that.
Okay.
Is there anything else that you think is important to know when we're talking about this? This is an update today on a Monday, nearly a week after.
Sure. I think both facilities are cooperating with us as we work through our investigation. It does take time to get all the information together to be able to really determine what caused these children to be sick, other than E. coli. We know that caused them to be sick. And I think it's important for parents and everybody to hear that, the risks are out there, and that, you need to be careful with what you eat and what you expose your kids to. And so, E. coli is a serious illness, and, properly cooking your food, not drinking the water when you swim, washing your hands, and not drinking raw milk are ways to avoid it.
When you go into the daycare to do your investigation, how do you go about that? How do you try to find where